Hey all, Dr. Michelle Dillon here. I wanted to fill you in with the conference that I just went this past weekend. I spent 22 hours in Raleigh learning about functional blood chemistry. The reason why functional blood chemistry is important is because a lot of times what does your doctor do when you go to the doctor? They run blood work. Now, what do they usually tell you about your blood work? They usually say it's normal, right? Oh, don't worry about it, it's normal. Well, do you want to be normal, which is average, or do you want to be optimal or functional, more functional ranges? So I just studied 22 hours of blood chemistry, which was super interesting to me, but yet it will help me determine exactly what is going on physiology-wise with you and know exactly what is the underlying deficiency that's causing the issues. So what I want you to know today is 4 different markers that you need to have your doctor run. Okay. Number 1 is check for anemia, iron levels, especially for women, but especially for men. There is something called hemochromatosis, which is high iron levels, and it is high in men. It usually happens after the age of 40. It can happen before that. It's genetic. And if this continues without being managed, there's between 1 to 3 years, a man can die. Or anybody can die with hemochromatosis because the iron levels get too high and it causes death. So it's super important. It's only picked out if you have high iron levels. So iron should be checked on everybody. There's a handful of anemias, and within those anemias, there's like 30 different reasons why you can be anemic. So one anemia, make sure you're getting checked by anemia or anemia. The second one is thyroid. When your thyroid is off, it can affect any part of your body. Having a thyroid that's off is the #1 reason women can't get pregnant. If your thyroid is off, you have receptors in all areas of your body, so it's going to affect any part of your body. But some low thyroid issues would be hair loss, dry skin, weight loss problems, memory issues, infertility, to name a few. So make sure that they're testing for thyroid. Know that when your regular medical doctor tests for thyroid, they only do 1 or 2 markers. They do TSH and then maybe T4 or T3. I usually run a 5 to 8 panel marker because you have to know exactly what's going on. With the thyroid, it could be upper management. It could be their hypothalamus or pituitary, which is causing a thyroid issue, or it could be the thyroid itself, or it could be the thyroid hormone, which is T3, T4. Then there's free T3 and total T4 and total T4 and free T4. So there's different particles of it. Then there's reverse T3, which is made when the stress is high in the body. When cortisol levels are high, it can make your reverse T3 high. So these are the markers that we need to run to determine what exactly is causing your thyroid imbalance. So we've covered anemia. 2 is thyroid. The third one is blood sugar. If your blood sugar is off, it's going to affect everything. When blood sugar is off, insulin levels are constantly going up and down. This up and down fluctuation of insulin can affect your hormonal receptor sites. It can also cause mood swings, cause sleep issues. Very important that you get your blood sugar checked. And most doctors do run a pretty decent blood sugar check markers. The fourth one is vitamin D. The vitamin D should be checked for everybody. If you live closer to the equator, like South Florida, then you're going to have better vitamin D levels and you can stay outside for a couple hours and get enough vitamin D. However, if you're higher than Georgia, then you definitely need some vitamin D and definitely get your vitamin D levels checked. Most levels, the optimal level for vitamin D is in the 80s, and most doctors think it's fine if it's in the 20s. So what you need is to check your vitamin D levels and then dose yourself accordingly. So the research that I have read shows that the dose should be 1,000 IUs per 25 pounds of body weight. If you weigh 100 pounds, you need 4,000 IUs of vitamin D. So most people don't take enough. To know that. We covered anemia, blood sugar, thyroid, and vitamin D. The higher levels of vitamin D, your lower levels of cancer. Higher levels of vitamin D, the lower chances of autoimmune. Higher levels of vitamin D, lower chances of getting sick. There's so much research showing that if you have enough adequate vitamin D levels, it helps lessen the duration of a common cold. So make sure that you're getting your vitamin D levels checked. They're saying vitamin D is less of a vitamin and more of a hormone because it's so involved with doing everything. Also helps you absorb your minerals. So if you're low on vitamin D, you're not absorbing your minerals well. So those are 4 things to look out for. 4 things to ask your doctor to run. Hope that helps. I'm Dr. Michelle Dillon with Charlotte Natural Wellness.